She is otherwise well with no significant family history. On examination, she has a nodule on the left lobe of the thyroid. A small discrete mass separate from the gland itself. Which is the following is the most likely diagnosis? Here the options are follicular carcinoma, anaplastic carcinoma, medullary carcinoma, papillary carcinoma, and B-cell lymphoma. So what may be the answer? And it occurs at 20 years old lady present with thyroid cancer, and there is a nodule of the left lobe of the thyroid, and most characteristics is this mass separate from the gland during palpation. So this is the most important point for diagnosis of the case. So first of all, the follicular carcinoma relatively less common. Relatively it is less common than that of the papillary carcinoma, because the papillary carcinoma it is the higher percentage. But in follicular carcinoma, these are the discrete nodule. This is the most important feature after the lymphatic invasion of the or bloodstream metastasis of the follicular carcinoma. And this follicular carcinoma also the well encapsulated macroscopically. So first of all, as it is the encapsulated, so a discrete nodule is felt in case of the follicular carcinoma. And the lymph node metastases are uncommon. So in case of the follicular carcinoma, usually blood metastasis occurs. What occurs in case of the follicular carcinoma? It is the blood, and the mnemonic is the FB, which is the Facebook or BF. So we can remember any of the mnemonics. One is the FB and another one is the BF. That means the follicular carcinoma, it is blood metastasis or blood metastasis by follicular carcinoma. And the follicular carcinoma tumor tends to spread hematogenously, that means through the blood, and mnemonic is the BF or FB. That means follicular carcinoma by the blood, or the blood metastasis by follicular carcinoma. And they translate into higher mortality rate. So the follicular carcinoma, as it is the less percentage, it is high mortality rate. Actually what happens, the cancer which usually the more common in this condition, actually the mortality rate is lower, or there is high chance of living. But in case of case of when there is less common tumor or less common carcinoma, in this condition mortality is high. The follicular lesion cannot be accurately diagnosed on the FNAC, and we should go for the core biopsy. If it is suspected follicular lesion, but there is a chance of bleeding. So we have to keep in mind during core biopsy, as there is a chance of the bleeding. And if we not suspect this is follicular, then FNAC is the best option. That's all follicular FNS. Thi3F will require at least the hemithyroidectomy. So what is the answer? It is the follicular carcinoma. Why follicular carcinoma? Because it is a thyroid gland swelling, but it can separate the gland. That means it can filled separately. So it is most likely diagnosis is the follicular carcinoma. And in case of the papillary and other condition, actually the nodule cannot be filled palpate. And in case of the anaplastic carcinoma, it is the early metastasis, and during the diagnosis usually the metastasis present. And in case of the medullary carcinoma, family history present. In case of the medullary carcinoma, family history present. In papillary carcinoma, it is the lymphatic metastasis. In papillary carcinoma, it is the lymphatic metastasis and more common. And B-cell lymphoma, they are the lymphocyte present. So the final answer is the follicular carcinoma. Thank you.